Welcome to another groundbreaking episode of Real World Strategy Dialogues powered by EY-Parthenon right here on businesstech.co.za. I'm Heather Orton, your host, and today we will be exploring how we maintain growth in a constantly changing environment within the health and well-being sector. I'm joined today by an expert in the field, Dr. Ron Whelan, CEO of Discovery Health, a renowned healthcare visionary with a vast experience in both healthcare and digital innovation. Prior to Discovery, he was the head of healthcare investments at Spinnaker Growth Partners. He co-led healthcare at McKinsey's and is both a co-founder and an executive director at Medicare Health and Healthforce. Welcome, Ron.
Great to be with you, Heather. Thank you for hosting me.
So I read recently that deaths due to chronic diseases such as diabetes and TB have risen almost 60% in the last 20 years. And more of us are going towards more public health care because we find it's more affordable. With this as a backdrop, how do you think about what is to come?
Well, I think it's important to note that TB and chronic disease are two entirely different ends of the disease spectrum. TB is an infectious disease caused by a bacteria, whereas chronic disease typically results of two main factors. One is aging populations, and the second is lifestyle factors. There is a third factor at play across chronic disease as well in genetics, and we're starting to learn a lot more around genetics. Now, TB is an interesting case example in that we do still see quite significant TB across both the developed world as well as the developing world. There are some important developments happening in TB now. So there's vaccine development underway, funded by the Gates Foundation in the main. It's a very, very exciting development. And we've long had a vaccine for TB in infants, but we've never had an adult vaccine for TB. So I think that illustrates for us is that we've still got to manage infectious diseases. We've still got to use the technology available to manage these infectious diseases, and in this particular instance, vaccines. Malaria is another important infectious disease where there is also vaccine development underway. So I think with advances in medical technology, hopefully we will continue to curtail the impact of these two dreadful diseases, malaria and TB. Chronic disease on the other end of the spectrum, as I said, is affected by three main factors. Firstly, aging populations, and we know that populations across the globe are aging. We typically see population aging by about 0.3 years per annum. Now think about that for a second. If you've got children and your children were born when you're the age of 30 years old, if we're increasing population age by 0.3 years per annum, that means that your children will live 10 years longer than you will live. Similarly, if you were born when your parents are 30 years old, you will live 10 years longer than your kids. So that's what population aging. And with population aging, we end up with greater chronic disease. Now, the fortunate thing around aging populations is that there's a big and emerging science around longevity. And longevity is an exciting space to be working in. And I think we're starting to see significant advances across the science of longevity. Now, related to aging, there are also lifestyle factors that impact chronic disease, most notably nutrition and diet factors and lack of physical activity, which typically results in people being overweight or obese. That then leads to a variety of conditions, most notably type 2 diabetes, ischemic heart disease, lung conditions, mental conditions, and so on and so forth. So in managing chronic disease, we need to be preventing these maintaining healthy lifestyles and healthy habits to avoid any semblance of being overweight or obese, and then avoid heart disease, diabetes, and so on and so forth. And then, as I said earlier on, genetics certainly seems to play a role, and lots of exciting developments in the field of genetics and genomics and epigenetics. And I think with the increasing development of that science and big data in the main, we're going to start to see some really, really interesting ways of managing chronic disease more effectively going forward.
And I think I shared with you my personal story with that because I 2 years ago, I had my genetics done. It was mainly in the pursuit of understanding my history because my mother was diagnosed with dementia. and I wanted to better plan for my future, which, as you said, might be longer than it used to be. And so what we're seeing is people are more interested in those customer experiences, and certainly the digital transformation and the power of data is becoming more and more important. And so how are you sort of adapting your strategy to take into consideration the kind of evolving digital engagement, but also kind of increasing customer demand?
Well, it's interesting. I think we're seeing two very big trends in healthcare at the moment from a technology standpoint. The first trend is in artificial intelligence and machine learning. Um, and if you've got access to big data sets, such as we've got at Discovery Health, and bearing in mind that our data sets span now over 30 years, include vitality data as well as Discovery Health claims data, and you're able to apply machine learning and artificial intelligence around that data, you're able to see some unique patterns and trends that you weren't able to see before. The second big trend is separate but linked in digital health. Digital health has become mainstream with an accelerated progress across digital health coming through COVID-19. So COVID-19 spurred on the development of telemedicine and various other digital health models, a proliferation of health apps and digital therapeutics, hospital at home models, and suddenly people across the globe are seeking care in very different places to where they used to seek care. You can seek care on your phone or in your home, in a retail setting. So digital health has certainly changed the landscape. So those are really the two big trends that are happening. What is Discovery Health doing across those two trends? Firstly, from an artificial intelligence and machine learning perspective, what we've done is we have consolidated all of the Discovery Health data sets. We've applied machine learning and artificial intelligence across those data sets with the sole purpose of trying to figure out what are the precise health actions that will allow our members to live longer and healthier lives, i.e. improve their health span and their lifespan. And through that exercise, we've been able to develop what we've called personal health pathways. Personal health pathways means that every single one of Discovery Health Medical Scheme's 2.2 adult members now has a personalized health pathway that is optimized for health span and lifespan. And I think that's a really exciting development and something we wouldn't have been able to do 5 or 6 years or so without the power of artificial intelligence and machine learning. On the digital health front, we've expanded the application of our member app. Now on the Discovery Health member app, you're able to submit a claim, do an authorization, check your statements, all the stuff you were able to do previously. But you're also able to book a doctor appointment. You're able to order medicine online. You're able to do cognitive behavioral therapy through our partner called Silver Cloud. You're able to see a doctor on the digital health app, the Discovery Health app at the moment. You have access to a doctor within 2 minutes of logging onto the app. And I think that really just demonstrates for you how these two trends, artificial intelligence and digital health, are changing the healthcare landscape.
And I suppose that brings me again nicely onto my next point, because I know that you are very passionate about affordable healthcare, and the debate or the conversation around the national health insurance continues. And there's still some big questions as to how are we going to financially and both physically resource this environment. How does it impact medical insurers and the role that they play? How will their business models need to change in order to support it? And how do we make sure it's successful in what has historically been quite a low growth economy? What is your perspective on the national insurance piece of work, and how are you thinking about applying it within the Discovery framework?
Well, I think the first thing to say is that universal health coverage is absolutely critical for South Africa. We unfortunately have a very unequal economy, a very unequal healthcare system, and we have to do everything possible to increase access to high quality and affordable healthcare across the population. And as you rightly mentioned in your question, I feel very, very passionately about this. Now, National Health Insurance, or NHI, is one way of achieving universal health coverage. And as Discovery, we certainly believe that the broad framework for the proposed NHI bill is is capable of achieving universal health coverage. However, we don't think that that's possible without effective private sector collaboration. We think the private sector is critical to the success of NHI. And the way the bill is worded at the moment is that many aspects of the bill, particularly the funding aspects of the bill, are to the exclusion of the private sector. How could the private sector then help NHI realize its goals of achieving universal health coverage? The first thing is that we need to increase funding into the healthcare system. So we need to be crowding funding into the healthcare system from all available pools and assets. And we certainly think that medical schemes could play a role in crowding funding into the healthcare system. We need somewhere in the order of 200 billion rand to fund the NHI proposal as it currently stands, or an additional 200 billion rand. Secondly, we need the full extent of the private sector capacity in the healthcare system to enable national health insurance. That includes private sector doctors and nurses and other healthcare professionals. It also includes private sector infrastructure. When one considers that South Africa has 400 hospitals in the public sector, or roughly 400 hospitals in the public sector, roughly 200 hospitals in the private sector, we really need to be running those assets together and leveraging the full extent of those assets to deliver on NHI. And then thirdly, it is a massive proposed program which will require very sophisticated administration. And we're very fortunate in South Africa to have very sophisticated claims administration systems, primarily through the medical scheme administrators like Discovery Health, extensive experience in claims administration at scale. And we could leverage some of those skills to run NHI at scale and run NHI effectively. Now, we have experience in this. We've had very effective public-private collaborations through COVID-19. They allowed us to deliver millions and millions of vaccines across the country, with the private sector working hand in hand with the public sector. So we've done this before and know how to do this. It's also important to point out that NHI will take many, many years to implement. In fact, will likely take decades to implement. It is a massive structural change to the healthcare system. It will not happen overnight. The National Department of Health has already indicated that decades are more likely than single year implementation. And for the foreseeable future, there will be no change in medical schemes. And I think as the water passes under the bridge on the implementation, the NHI will come out in the right space where it's really is to the benefit of all South Africans. So lots of ground still to cover on the NHI debate. We are deeply involved in the NHI debate and are committed to a positive outcome, one way or the other.
Thanks, Ron. So bringing it back to Discovery Health, what are some of the strategic imperatives that you feel you need to get right to be successful?
Well, I think we've just come through our strategic planning process. We always spend the first quarter working on our strategic plan, and we've set 5 main priorities around our strategic plan, which I'm happy to share with you. The first one is that we've got to drive towards high-quality healthcare. And we're fortunate across South Africa to have a very strong healthcare system and a healthcare community, some of the best doctors in the world, some of the best facilities in the world. And we've got to make sure that certainly medical scheme members and the broader population have access to those high-quality facilities. Secondly, as I mentioned a little bit earlier on, we've got to make healthcare more convenient. And the benefit with digital health is that you can make healthcare more convenient. You can provide the same quality of healthcare, and you can increase access at a similar cost to what you're paying at the moment. In fact, in many respects, you can deliver it more efficiently on a digital basis and more conveniently. I think thirdly, we've got to move into an environment where we are personalizing healthcare. So the world of personalized healthcare has dawned upon us now. It's enabled by artificial intelligence and big data and machine learning. The age of precision medicine is now upon us. And I think we're going to continue to see significant developments in both personalized healthcare and precision medicine. Fourthly, we know that medical inflation typically outstrips consumer price inflation by somewhere around 3 to 4%. So you'll see over time, medical costs go up significantly higher than consumer price inflation. But we've got to work hard on making sure that we're able to deliver the right quality, the right technologies, the most innovative medicines at affordable price points so that we can increase access to care. And then finally, as a fifth pillar in our strategy, we are fully committed to broader health system development and doing what we can as Discovery Health to broaden access to high quality care across a broader cross section of the population. We already serve 3.5 million members across a range of Discovery Health administered client schemes. And our intention is to continue to serve those members well, and at the same time offer a broader range of products and services that allow us to increase access across a broader cross-section of the population.
Are you afraid that a robot might replace your job?
That's a great question. I mean, I think what we've seen in technology over the ages is that in as much as technology has replaced certain jobs and certain occupations, and when you think back to the early cities we had candle lighters for street lights. You don't need candle lighters for street lights anymore, but those jobs are typically replaced by other jobs in the marketplace. And I think with the burgeoning development in technology, there are going to be many other jobs replaced. And then I think what's most important is that I think it will be hard for technology to replace sheer creativity over time. So jobs that require natural creativity and innovative thinking will certainly remain for long periods of time. So I see technology as a way to make our day-to-day work more efficient and more streamlined, but I don't see it taking away jobs at scale.
And I tend to agree, because I had a debate with a colleague of mine who's a very esteemed data scientist, and we always said, is artificial the right word, or should it be augmented intelligence? Because it takes what we do, and for me, it augments it. It plays it back in a different way so that you can actually build on it. And I remember I attended a talk with a composer, and he was actually loading his compositions into an AI engine, and then he was getting the AI engine to play it back to him. And one of the audience members said, but is it still your work? And he said, well, yes, of course it is, because I was the input. It took my work. It played my work back at me. So it's still technically my work. But I do think that sort of ethical debate around how we continue to apply artificial intelligence, it still has a lot of conversations to have.
And if you think about artificial intelligence as a way to speed things up, so for example, in coding, coding now is just dramatically faster than what it used to be, and that allows us to develop more code. It allows us to develop more products and services at a greater pace. So I think it opens up a new range of opportunities.
Agreed. So shifting focus now to the personal side of strategy, what guiding principles or strategies do you employ to successfully navigate the significant responsibilities of your role?
Well, Heather, I work for a healthcare organization whose core purpose is to make people healthier. So I focus on A, keeping myself healthy, B, keeping our people healthy across Discovery Health. That's over 5,500 people. And C, doing everything possible to keep our clients as healthy as possible. Healthcare is the fabric of our organization. What I do to keep myself healthy? Well, firstly, I focus on physical activity. So I'm an avid runner, trail running in particular. I aim to run at least 3 times a week in the morning. That's a great stress reliever. It's a great connection with friends and colleagues in the neighborhood, and it helps keep me in reasonably good shape and keeps my joints nice and mobile. We know that mobile joints are good for longevity and aging. Secondly, I aim for at least 7 hours of sleep a night. I need 7 hours of sleep a night. I know that. If I get my 7 hours, then I'm productive the following day. I'm energized the following day. Occasionally, I miss my 7 hours, but in general, I aim for at least 7 hours of sleep. And then thirdly, I aim to be home for dinner every night. It's important for me to have dinner with my family every night. We sit around the dining room table. It's a religious and important tradition for us every night, getting together with the kids and my wife, having a conversation around the day that's just passed. And then we all scatter in our own directions. I might go and do some work, and the kids will do their homework. And my wife will likely tuck into a good book or TV program. So that's my recipe for coping with some of the stresses and strains in my job.
Thanks, Ron. And thanks so much for sharing your expertise and insights with us today here on the Real World Strategy Dialogues. It's been fascinating. I know we're living longer. I know we are, looking to live healthier. I know that you are focusing on personalization and continuing the debate around universal healthcare. It's been an absolute privilege to host you. From both of us, we hope we've given you something to think about. And until next time, stay curious and keep asking better questions.
Thank you, Heather. Much appreciated.